heart disease remains a significant threat, ranking among the foremost causes of death globally. A silent contributor to this crisis is the buildup of plaque within the arteries. This disturbing reality often leads to conditions like coronary artery disease, CAD, where arteries narrow, restricting vital blood flow to the heart. For those affected, a cutting-edge intervention, known as angioplasty with stent placement, offers a beacon of hope, restoring life-saving circulation and improving heart health dramatically. The heart, the core of our circulatory system, demands a consistent supply of oxygen-rich blood. However, when plaque accumulates, perhaps resembling stubborn asphalt obstructing a once bustling highway, the consequences can be dire. An angioplasty procedure aims to clear this congested pathway. At the heart of this process is the stent, a small mesh tube meticulously crafted to re-establish blood flow by propelling open the obstructed artery, effectively acting as a scaffold amidst an intricate vascular landscape. By engaging in this vital procedure, patients take an empowering step towards safeguarding their overall health and well-being. Prior to delving into the actual procedure, patients undergo a series of thorough evaluations. Picture a healthcare team diligently working behind the scenes, equipped with an array of instruments. The initial ECG provides an essential glimpse into the heart's rhythmic performance, while blood tests serve as a compass of overall health status. The echocardiogram unveils a dynamic snapshot, revealing the heart's structure and function. Finally, coronary angiography acts as a strategic reconnaissance mission, pinpointing the exact location of blockages. In preparation, patients are advised to abstain from food for several hours, ensuring their readiness for intervention. Blood-thinning medications, such as aspirin, may also be administered to mitigate clotting risks, fostering a safer surgical environment. When the day of the procedure arrives, anticipation fills the air. With the healthcare professionals poised and ready, the patient finds a sense of calm in knowing that this innovative approach aims to obliterate the barriers to healthy blood flow. As the process unfolds, technology merges with expert hands, showcasing modern medicine's remarkable capability. Through this meticulous journey, patients are offered a chance not only to reclaim their health, but also to rediscover the richness of life, unburdened by the threat of heart disease. Let's delve into the crucial steps involved. In the stent placement procedure, it begins with catheter insertion, a procedure that may seem daunting, but is performed with precision. A small incision is carefully made in the wrist or groin, allowing access to the artery. With meticulous guidance, a thin tube known as a catheter is inserted. The doctor uses X-ray imaging to navigate this catheter through the intricate network of blood vessels toward the heart. This step sets the stage for the intervention, designed to improve blood flow. Next comes angiography, a vital process for locating any blockages. As the doctor injects a special contrast dye into the blood vessels, the arteries become vividly illuminated on the X-ray screen. Each image reveals the state of the blood vessels, allowing for precise identification of any obstructions. This visual aid is crucial in diagnosing the condition effectively and determining the most appropriate course of action for treatment. With blockage identified, the focus shifts to balloon angioplasty. A small balloon-tipped catheter is introduced precisely at the blockage site. As the balloon is inflated, it exerts pressure against the plaque buildup, artfully reshaping and widening the artery's passage. This step is both transformative and refreshingly effective. Following this, the stent placement occurs. A metal mesh tube is strategically positioned at the blockage site. Inflating the balloon inside the stent causes it to expand, securing the artery's newly formed opening. Finally, the balloon is removed, leaving behind a stent that ensures lasting stability and blood flow. Crucial to the success of this process is the patient's recovery phase. Post-procedure, patients are closely monitored for several hours, a period essential for ensuring safety and comfort. Most will find themselves ready to return home within 24 to 48 hours, embarking on a new chapter of heart health. To facilitate this journey, blood-thinning medications such as aspirin and clopidogrel are prescribed to prevent clots. A heart-healthy lifestyle becomes paramount, nourishing the body with fruits, vegetables, and proteins while embracing regular exercise is vital. Additionally, managing stress and prioritizing sleep significantly bolster recovery and enhance overall well-being. However, informing patients about the potential risks associated with heart stent procedures is equally important. Though generally safe, there are considerations to keep in mind. These may include bleeding or infection at the catheter site, and the rare chance of re-narrowing the artery, known as restenosis, blood clots on the stent, or even the possibility of a heart attack or stroke, although rare, warrant mindfulness. Embracing a healthy lifestyle can mitigate these risks, fostering a heart that remains robust and resilient.